The Federal Aviation Administration says that it provides the safest, most efficient aerospace system in the world. But does it really? Welcome to Freedom Alive. The FAA states that it provides safe air travel, yet in a 7-month period in 2022, there's been a 300% increase in long-term disabilities among the pilots of just one airline. 300%. Josh Yoder is a commercial pilot and co-founder of U.S. Freedom Flyers. It's an all-volunteer organization that gives support for transportation employees against medical tyranny. Josh joins us today to reveal what's really going on behind the scenes since the rollout of the COVID shots at the FAA. I'm blessed to be joined again by co-host Matt Staver. And Matt, many pilots were fired for refusing to take the COVID shots. But now the adverse effect of those who did take it are really alarming. And considering that most of us get on a plane trusting that we'll get to our destination safely, it's very concerning. The public is not being told the truth.
Yeah, Josh Yoder and so many other pilots that we work with at Liberty Counsel to protect their religious freedom and the right to be able to say no to the COVID jab have such amazing stories that are startling with respect to what's happening with not only pilots, but people within the airline industry. These are your mechanics, people that are working in all different areas, those that are assisting on the airplane, all different aspects, but particularly the pilots. That's what obviously is concerning to most people, because those are the individuals up there. Sometimes there's only two up there in the cockpit. And when one of those has a problem, as we know some have had,
yes,
in flight or just after landing, we actually had a program on this issue with one of the pilots, Bob Snow,
Yep.
who had cardiac failure 6 minutes after landing as a result of the COVID jab. So this is really concerning. And the FAA, you would think, like the CDC, like, the all the different agencies, you would think that they would be concerned with public health and safety.
Yeah.
And you would also think that they would be alarmed with what they're seeing, and they are not telling the truth to the American public, and that puts us all at risk.
This is an alarming, remarkable story that it's also true, and it's our delight to bring it to you. Our Freedom Alert is next.
Military brass avoid the truth during COVID shot mandate hearing. I'm Matt Staver, co-host of Freedom Alive. During a recent subcommittee hearing, top military leaders revealed that they don't have a plan to reinstate or compensate service members who were discharged for refusing the unlawful COVID shot mandate. They gave answers like, "I'll have to get back with you on that," or "Our plan is the same as it's always been." They denied using blanket denials for religious accommodations, which the Inspector General's report confirms they did. The Department of Defense and high-ranking military brass act as though they are above the law. They appear to have little to no concern for the truth, the law, and our troops. There needs to be a complete transformation of the system, beginning with the Secretary of Defense and the top Pentagon brass.
Up next, Matt's interview with Josh Yoder.
I'm pleased to welcome our special guest, Josh Yoder. He is a veteran commercial airline pilot and co-founder of U.S. Freedom Flyers. Welcome to Freedom Alive, Josh.
Thank you for having me on, Matt.
Josh, you've been on the program before, and we've talked about what's happening within the airline industry with respect specifically to the COVID shot mandate. But since we had you on, a lot has happened. I want you to give our viewers, our listeners, an update. In fact, one of the startling things, just to begin with, in fact, I'm getting ready to take a flight on one of these aircraft, and you have mentioned that there is a 300%, or the data is showing that there's a 300% increase in long-term disabilities among the pilots in just one airline alone, and that airline is American.
That is correct, Matt. Yes, and it's not just American where these things are happening. It's happening across the board. That is specifically where we have hard data. That was in a union email that was published by the pilots union in July of 2022. So over a 7-month period, there was a 300% increase in long-term disability claims. And this would seem to correlate with the anecdotal evidence that I continue to receive on almost a daily basis. The number of phone calls from vaccine injured pilots, mostly heart damage and neurological conditions, seems to be increasing. Just a few days ago, again, a young pilot in his early 20s has now been flying for a year and a half with severe crushing chest pain. And it became so bad during a flight that he had to be removed at the end. And now, I'm working with him, working with several families, many families actually getting these people care.
I remember when United Airlines became, I believe, the first airline to issue this COVID mandate back in 2021, and then others followed suit right after that. I read a document that United had entered into with the airline pilots union, and it in fact talked about the incentives that pilots would get if they got the jab. And then when it got mandated, of course, they had to get the jab or they would lose their job. But it also specifically said in there that if, in fact, you have an injury from these shots, it talked about the short-term disability that you would receive and then the long-term disability that you would receive if it went past a certain number of days. It was right in the very same mandate or discussion about consequences from getting the jab that you would actually be, don't worry about it, you've got short-term disability, and if it goes longer than that, you've got long-term disability as well. But now what you're seeing right here with this shocking statistic in just American, and it's going to be like that same statistic in any other airline that mandated this jab as well, 300% increase in long-term disability. These are people that are not going back into the cockpit.
That's correct in most cases, Matt. I mean, it depends on the injury. There are certainly people that can recover if they receive early enough treatment. And that number is actually more significant than it even sounds. And I say that because there's a large number of pilots I know for sure at American and also several other airlines who actually have either fake or not fake vaccine cards, but there were providers around the country that were giving out real vaccine cards, but in fact not giving the vaccines. I know the number that I'm hearing that I've heard from friends at American Airlines is between 3,000 and 4,000 pilots out of about 14,000 active pilots that actually didn't get the shot. So those numbers are more significant than had every pilot at that airline taken the shot.
Wow. So a lot of pilots did push back. Some of them lost their jobs, but some of them then got these certificates that suggested that they might have had the vax so that they wouldn't have to get the vax, but they were still able to get their job. And now I'm sure they're very happy that they did because they don't have the side effects of some of these situations from these COVID shots. You mentioned some of these individuals. You've got some examples of some pilots. Cody Flint is one example. Tell us about his situation.
Cody Flint is a good friend of mine, and he was one of the people that was injured early on. This was back in February of 2021. And, he got the first Pfizer shot. He waited the mandatory 48 hours before he flew an aircraft. And right at that 48 to 49 hour mark, he got in his airplane. He actually passed out while he was flying, doesn't remember landing his aircraft. It was an act of God and a miracle that he's even here to speak with us, But he's been an important voice. His bravery in coming forward with his injuries has brought many other pilots forward publicly now. We have people like Captain Bob Snow, who, collapsed in the flight deck in cardiac arrest 6 minutes after landing at American Airlines Airbus 321 in Dallas-Fort Worth. And then we have pilots like Sierra Lund, a 23-year-old pilot and bodybuilder who 18 hours after the first Moderna shot collapsed with cardiac arrest type symptoms. And she now has myocarditis and pericarditis. And she's one of the pilots that's being assisted by U.S. freedom flyers. And the list goes on. There have been so many of them. And not just happening here in the U.S., it's happening across the world. I have close contacts in Australia with the Aussie freedom flyers. They've seen a significant uptick as well in pilot injuries. There was just another pilot incapacitation 2 days ago where the first officer, he had a heart attack, and it took them 70 minutes to get on the ground for him to receive care. So we're hearing about all these incapacitations. They're happening everywhere. We hear about a small percentage of them. And unfortunately, the airlines and the unions and the FAA, they're not coming clean with the true numbers.
There was that story also about the aircraft that took off, I believe, in Chicago, and shortly after takeoff, one of the captains in training, I believe it was, suffered a heart attack and died in mid-flight. When they took him off the plane, he was already gone. So
yeah, that's correct. That would have been that was also an American Eagle flight on what 3556, Captain Patrick Ford. And why this is significant is that happened before, like within 90 seconds of that aircraft being cleared for takeoff. And we estimate that aircraft was between about 2,000 and 3,000 feet when that occurred. Had that been 2 trips later, he would not have been flying with a senior check pilot who was actually training him at the time. But it would have been it could have been a brand new first officer that was new to the company and new to the airplane. If we continue to play Russian roulette, this doesn't end well.
It doesn't end well, and you would think that the FAA, the Federal Aviation Authority, would want to make sure that this is the safe place. That's the kind of mantra that we have, from them. That, we heard the safe and effective mantra from the FDA, the Food and Drug Administration, the CDC, the Centers for Disease Control and Prevention, the NIH, National Institutes of Health, with regards to the shots and everything else. The FAA, obviously, we trust them, or have in the past trusted them, to be able to do the right thing, make sure that these standards are in place so that we have the best qualified pilots and the best aircraft that are able to transport people. What's happening within the FAA? Because the watchdog seems to be the lapdog, perhaps for pharmaceutical companies and even the unions. Where are they in all of this? But let's start with the FAA.
You're right about the FAA. Their mantra is actually to provide the safest and most efficient aerospace system in the world. As these issues have come to light with pilots, rather than double down with additional testing and providing additional care for pilots, they've actually relaxed the standards across many fields, including cardiac standards, as it pertains to the EKG, which pilots can get in a flight physical. They actually extended the acceptable PR interval by 100%. From 1.2, typically the old range was 1.2 to 200 milliseconds. That was acceptable, and anything outside of those parameters required additional follow-up. Well, now they've extended the acceptable range out to 300 milliseconds. And as cardiologists such as Dr. Thomas E. Levy speak to, he speaks to a Harvard study that was done over 30 years. It says even a 10 to 15% increase in a PR interval makes you 300% more likely to have a pacemaker, and 50% increase in all-cause mortality. So what the FAA is doing is seeing an issue, realizing that pilots can't pass their flight physicals now that they've gotten the shot, so they have extended the range. And we've reached out to the FAA, myself, Steve Kirsch, and many others, many of these vaccine-injured pilots, demanding answers. And they tell us there's new data, there's new science. However, no one else in the medical community has changed the standard. The standard has remained what it has been for over 100 years. And there's no explanation from the FAA. They keep banging the drum of new science, but they can't provide any documentation.
So what happens is typically the EKG, if you have a certain marker on that and it's abnormal up until recently when they change it, then you'd have to go through different tests and to find out, can you be cleared based on your cardiac results to continue to fly, or do you need some other kind of remedial treatment, or maybe even perhaps be removed from the cockpit? Now what you're saying is those subsequent tests won't even be done because they've dumbed down the standard, and therefore more pilots will be flying that perhaps should be offline or getting some other kind of treatment. But they're not, because the FAA has changed the original EKG standard.
That's correct. And this is most concerning because there is no testing done for things like myocarditis. And we know that's a #1 side effect of these shots. And we know that the most affected age range is males from 18 to 39 years old. So there's no testing being done. That's about 50% of your current commercial pilot population falls into that range. And what's even more concerning is a pilot doesn't receive any cardiac testing, not even an EKG, until the age of 35, at which you get a baseline test, and then you don't get another one until the age of 40, after which you get one per year. So the highest risk group of pilots, which is mostly males and mostly in that age range, are not being tested for a deadly killer. I mean, subclinical myocarditis, inflammation of the heart muscle, in 53% of cases, I believe it was in the Thailand study, have zero symptoms. So you can see why this is a ticking time bomb, and just looking the other way isn't going to solve the problem.
Are the airlines in general still, while they may not have a mandate perhaps, are they still pushing these shots?
They are absolutely pressuring people to get them. Emails constantly come out talking about the boosters. They haven't really backed off. The mandate has been removed in most cases. There are still there are 2-3 companies that fired employees, major airlines, and now some of them are taking the old employees back, but they're not bringing them in at the seniority which they had when they left. They're bringing them in at the bottom if they want to come back. It's just completely unacceptable. I mean, the stance they took was 100% totalitarian, and unfortunately, they go after people who speak out against it. This has become a common thread. There's been such a push of woke culture at the airlines. It's incredible. I know of quite a few cases now where employees are starting to push back. There are lawsuits being filed. And I think as we continue into the future, obviously the FAA, we're working on an FAA lawsuit right now at U.S. Freedom Flyers, and we need to hold these people to account because they have been very destructive in their policies, and they've lost the trust of the American passenger.
Passengers have a big voice. How can they exercise their leverage of their consumer ability to fly and make a difference?
We need every passenger who's concerned about this issue to be reaching out to your airlines. You should be emailing the CEOs and all the other the public emails that are listed, as well as the FAA. There has to be public pressure. I think once you see about a 15% shift in the market, once people start to vote with their dollars, they're going to have no choice but to actually take this issue and address it seriously. Unfortunately, at the rate that we're going, it appears as if we're going to have to bend metal before they start to care. And this has been kind of a longstanding thing at the FAA. They typically don't make sweeping changes until a catastrophe happens, and that's what we're trying to avoid this time.
Are there any airlines that are setting a good example in this area?
They're really not. No, maybe some of the smaller regional airlines, they were much less heavy-handed, but only because they knew that their employees, they're not paid the same as a major airline pilot, and they knew that they would lose most of their workforce if they came out with mandates. So there were a few that backed off earlier on, but as a whole, you can estimate that about 80% of your airline pilots are now vaccinated.
Wow, 80%. That's an incredible, startling number. You also mentioned about the wokeness that has infiltrated the FAA, and I assume also some of these airlines. I know, for example, when we were working with United early on, we found that some of the top management actually were in the Obama administration with a very liberal worldview and ideology, and they moved from the Obama administration to some of the top management in United. And so therefore you had some of that idea of this just totalitarianism that they were literally putting on the rest of the people. And they were telling, some of the top people of United were telling the pilots and the staff, get the shot or get out of here. We don't want you. It was unbelievable, the lack of concern for their people. And obviously that translates into the lack of concern for the consuming public.
Yeah, that's correct. There's been a major push for diversity, equity, and inclusion, DEI, both at the FAA and at the airlines. A primary example of this would be Biden's nominee for the new director of the FAA. His name is Phil Washington. He's a military veteran. He used to run the Los Angeles County Transit Authority. Back in September of 2022, he was served with multiple felony warrants for corruption charges. And then he ran the Denver airport for a short period. And now he's being considered as the top person at the FAA. He has no aviation experience. And recently, during a Senate confirmation hearing, Ted Budd, senator from North Carolina, was grilling him on some very basic questions that any pilot, anyone in the FAA should be able to answer. And he was 0 for 7. He couldn't answer a single one.
Oh my.
And yet the left is pushing to confirm him at a time when we've had so many near misses, not just with the vaccine injuries, but a general relaxation in standards. You saw the United flight that almost plunged into the ocean,
right,
leaving Hawaii. You've seen all the near misses that have happened at our nation's airports. And at a time where we need someone with true experience, with a safety background, who understands the complexity of these issues, instead of finding someone like that, they put someone like Phil Washington up, who has no experience, and they expect him to turn around a failing agency.
Well, I assume that's because he's going to push diversity, equity, and inclusion, the DEI agenda.
He very clearly stated that. As a matter of fact, in that Senate hearing, he was being asked those questions. I saw the video yesterday, and they asked, he was asked what his opinion is, and he said it's a very important aspect of everything that he has done in the past and what he intends to do in the future. And that's reflected by what I'm hearing from FAA employees. They say that the FAA has become a nearly unbearable place to work.
And for those that don't understand the difference in language, equity is not equality. Equality is getting equal opportunity, and the best person in that cockpit as a pilot, as an example. you have the opportunity to be able to achieve that level of flying a commercial aircraft, but it's going to be the best people that's in there. And that, as a individual who's flying, helps us to have some confidence that people that are in that cockpit, they have been experienced and they've worked their way through the ranks and they're able to be there in that commercial airline. But equity doesn't look at equality. It looks at, well, how many people can we put in there that, whether they're qualified or not, are of a certain race or a certain gender, or whether they're LGBTQ? I mean, it looks at things that are completely opposite from quality, experience, and the ability to be able to fly that aircraft.
Matt, I work with people from all different races, countries, ethnicities, backgrounds that are incredible pilots. And no one is suggesting that there should be any type of discrimination. But as you stated, the only thing a passenger cares about, and the only thing that the FAA and the airline should care about, is the qualifications of those pilots and the qualifications of the people, making regulations and working at the FAA level. But unfortunately, we've seen exactly the opposite of that. It's like they're now hiring people based on their ethnicity, background, and gender or sexual orientation versus true qualification. And I believe that's why you're seeing some of the degradation of safety.
I think it's great to have a diversity, but from this particular standpoint, to have people that are qualified and not pick people just because they come from a particular group, a special group, that are otherwise, in their particular situation, underqualified when someone else is more qualified to be in that position, especially when you're talking about putting the lives of all these passengers in the hands of, just a couple of people. A lot of these aircraft only have 2 pilots. They're in the front cockpit. 2 people literally have all these people in their hands. I know, the FAA is breaking its own rules as well. You have mentioned something to this effect, how, the COVID shot, when it was an emergency use authorization in December of 2020, the very next day, December 12th, after it became a EUA approval, the FAA began encouraging pilots and air traffic controllers to get the shot. And that's when it was brand new, the day after it was approved as an emergency use authorization drug.
That's correct. The FAA violated all of their own protocols. Typically, when a new medication comes to market, it has to, receive full FDA approval. It actually states in the Aeromedical Examiner's Guide for the medical doctors who give out flight physicals that no pilot should be taking a drug until 12 months post full FDA approval, for the very purpose of ensuring there's no negative side effects that would affect the safety of flight. Those then new medications typically go through altitude testing, through pressure testing. They take a small subset of pilots. They monitor them closely to ensure that no negative side effects occur. They did none of this. They completely violated their own rulemaking procedure, didn't follow their own guidance. And that's why we're seeing what we're seeing now. This has never happened in the history of the FAA. They typically study things for years before they allow pilots to take even benign medications. I can't take something like a Zyrtec or NyQuil and go fly the next day. It's actually illegal.
Is that right?
And yet this drug, with known side effects such as myocarditis, pericarditis, heart attack, stroke, and blood clot, and we could just go down the list, neurological dysfunction, all things that are exceptionally dangerous for a pilot. They not only approved it, but were pushing this vaccine, and it was their approval of it that allowed the airlines to then mandate.
Well, you're doing a great job, Josh. You and U.S. Freedom Flyers. Again, I encourage people to go to your website. It's on the screen there for people to find out more information and to make your voice heard to the airlines, the various airlines that you fly, and also to the FAA. Josh Yoder is our special guest. Thank you for joining us on Freedom Alive.
Matt, another amazing story from the very front line, so close. Josh is just at the heartbeat, really, of the entire industry and so close to this issue. The credibility that he has shared with our viewers. And it just reminds me of just another example of a company, or in this case, an entire industry that will do everything possible to keep the profit-making machine going forward.
Yeah, it's you would think that it would be something along those lines, but it's more than just profit. It's ideology. Mm-hmm. Because it is contrary to profit. It's contrary to take your best performing employees, for example, and then put them in a situation where they have to choose a jab or their job, when we now know, and we knew then, that it was not effective. It was neither safe nor effective. And it's hurting people. And then the worst thing beyond that is you have a federal agency, the FAA, that's supposed to be looking out to make sure that the aircraft and those who operate them are safe, and they know this information. It's undisputed, for example, about the risk to males of a certain age group, which is going to be primarily your pilots, in terms of myocarditis and pericarditis and the serious situation that that causes in young males. And yet this is a large portion of our pilots. They know that. The data is undisputed. It's been undisputed for a while. Why do they keep pushing these kinds of shots? Why did they do it in the first place? And why are they covering up, and why aren't they taking immediate remedial action to address this and admit, frankly, that they were wrong? So that, I think, is something that's even more disturbing than even the airlines, is that our federal agencies are not doing their job. And in fact, they're infected by other kinds of agendas rather than how they were originally established to protect the health and safety of the American people.
I'm amazed that the 80% number, right, of vaccinated pilots, even in the absence of mandates, right, there's still the heavy-handedness and the aggressive push toward that issue with pilots. 80%.
Yeah, 80%, that's a lot of pilots that, you know, you think about getting on the aircraft. I'll be getting on an aircraft in many times in the future and have in the past, and flying on some of these aircraft that actually had the 300% increase in disability, long-term disability. That is unimaginable, to get into an aircraft like that and wonder, what's the health of your pilots? Did they get the shot or did they not? And knowing people that we've actually interviewed on this program, particularly an American Airlines pilot, Bob Snow. He had cardiac failure 6 minutes after he landed on an American Airlines aircraft in Dallas-Fort Worth. And we had photographs of him in the hospital with all of the cardiac monitoring on his body. He may never get in the aircraft again as a pilot, but you have individuals like that who have indisputable issues and injuries from these shots.
I agree. We're so blessed to be able to have courageous warriors like Josh Yoder that we're able to bring to you at home. It's our delight to tackle issues like this for you, bring this information to you and your family so that you can make the best decisions. In closing, remember Galatians 5 verse 1, which says, "It was for freedom that Christ set us free. Therefore, keep standing firm and do not be subject again to a yoke of slavery." Our freedom is a gift from our Creator. We must never forget that and always protect it. So join us here next time, where you'll hear victories as well as ways you can stand up for your priceless freedom. Join us again for Freedom Alive.